Shame and denial have ruined more lives than illnesses and disorders. People think it's a weakness, it's a flaw in character, it's something that your family is responsible, or it's something that you're responsible for, it's something that you did. Shame is brought on by people around you. Things that we read, people write things, people say things. Mad, psycho, mental, loco, spaz, retard. These are words. These are not just words. They are powerful words. They are stones. They are barriers. They are the ones that let you not seek help. They are the ones that you shame your friends and relatives with, so that it takes them longer to reach to a doctor. Shame is brought by your own relatives and your own family member, either from them or from within you. How can I be somebody like this? I'm this one's so-and-so's child. We all have stories of where we know that when we wanted to do something, people have come and given their 2 bits to us, and that has completely messed up our own thinking. Here we are trying to reach to a psychiatrist, gathering the courage to even get ourselves diagnosed. And here they are telling us how that actually makes us weak. It's just in my head. It's just, all I need to do is just chill. I just think too much. These are, again, not just words, they are barriers. I am a psychiatrist. I see the step-sisterly treatment towards a medical field every day of my life. People who come to us, we're very proud of them, because not only have they overcome their own feelings and apprehensions, but they've also overcome all these stigmas and all these powerful barriers around them, and they've reached us finally. So they're the warriors. We have to support them, not bring them down further. It should not be up to them to explain to you that how it's not in their head, how it does not make them weak. It's not because only one small thing happened. And it's enough to make them feel as if what they are doing, it's better not to take help. It's easier to suffer than to face all this and to keep explaining to everybody. You're there to help them. We're all there to help them. We should be their support system, not something that brings them down again. It's okay if you don't understand it. Ask them. Don't tell them what to do. Suggest things that you think will soothe you. Don't talk down to them. Don't say, oh, you just need to get rip-roaring drunk one day. Don't say all you have to do is go have sex with someone. Don't say get it out of your system by doing something. Some things help momentarily, but they're not a solution. They're not a treatment. They're not a cure. Try things, reach out to people, share with people, let them help you how they think will help you. But always remember that you do need to treat. You do need to treat the illness. You do need to treat that shame. You do need to treat the denial that doesn't allow you to seek help. It's not a fad. It's not a passing fancy. It's an illness. It's an illness that is treatable. It's an illness that requires an entire village to get better, because they want to know that you're there for them. They want to know that what they're doing, what they're trying, they're not crazy. They want you to be there for them. Denial is something where even when we are telling people that this is an illness and you need to take care of it and it is treatable and you need to treat it, they don't want to accept that this is an illness. They will try for a whole lot of quick fixes. Where there's no shame and denial, there's ignorance. Ignorance that it is an illness. That drives you to a lot of quacks. People, especially in our country, will go to faith healers. Every religion has a faith healer. Nothing wrong with going to a spiritual guide. But there is something wrong if you think that an illness is because only of spiritual reasons. Nothing wrong in praying to God. Nothing wrong in seeking help from the divine creation. But that's help. God himself or herself will tell you, I'll listen to your prayers, but go get some help. Another problem that we have is, when we write a prescription, and you go to the chemist to try to fill it out. The chemist will give you points. Oh, these medications are really bad. Why do you need to take them? And that keeps a lot of our clients from taking medications. We have doctors telling people that, oh, you don't need to take these medications, stop them. And one month down the line, they come back with a severe illness again. We've had people deciding not to take medications because it's too difficult for them to go and take medicines or even take help or even go for counseling. And then they suffer for years. A lot of times people will come and ask us, are you sure this is an illness and it's not a spirit, or it's not black magic, or it's not something else? And we have to explain to them, and we do. And a lot of them, they understand it when we explain it to them, because ignorance is there. Ignorance is everywhere. People don't talk about mental illnesses in their living rooms the way we talk about diabetes or common cold or hypertension or even cancer for that matter. We feel ashamed. If I talk about depression or anxiety or schizophrenia or alcoholism, people might suspect that, oh, maybe she's suffering from something, or if maybe her husband is. And that's why I might not share my information. I might not talk about it the way we talk about that, oh, which doctor do you go to for this? There are a lot of quacks out there that they think that they'll fix you, or they just want your money and they'll take you to another direction. So be careful of who you go to. Vet out your expert. Are they really an expert? Anybody can make you feel better momentarily, but they can't make you feel better from an illness. So be careful of the expert that you choose. Get help. Get better. Be your own best friend.